Okay, I'm Richard Tetefoli from Group 2, and I'll be talking about the normal urine output for children and adults per 24 hours and per hour, and how it relates to the body weight of the patient. So for the normal urine output test, we have the 24-hour test and the per hour test. So for the 24-hour urine test, it tests the amount of urine excreted in a day, and it checks the amount of creatinine, urea, and other excretory products in urine. So it entails collecting all the urine excreted in a day. The first urine on the first morning of day 1 is not collected, so it's disposed of in your usual way in your private. Then afterwards, all other urines are collected in a tube and labeled. In a day, there's about 800 milliliters to 2000 milliliters excreted urine. And for the per hour test, for adults, the ratio is about 0.5 to 1 milliliter per kilogram per hour, and for children is 1 milliliter per kilogram per hour. This ratio is to help you know the right amount of urine that a child or an adult should excrete every hour. And since urine is not passed out every hour in hospital, patients are connected to catheters, which helps them excrete water every hour, and that urine is tested, and this ratio is used appropriately. Yeah. And so when a patient is 70 kilograms, using the ratio of 1 mils per kilograms per hour, we can determine that the amount of urine excreted by this patient, the normal amount, should be 70 mils. With this information at hand, if the patient excretes more than or very little, we can know whether the patient is suffering from either polyuria or anuria or oliguria. So with the help of this information, you can know whether to increase intake of fluids for patients or decrease it in order to gain normal amounts of urine every day.